Dorothea Dix, Mental Health Advocate by Emily McCandless
and Dara Valdez Romero. If you were to pick up a dictionary and flip to the page on mental illnesses, you would learn that they are behavioral or mental patterns that cause significant distress or impairment of personal functioning. But these disorders are so much more than a few words on a piece of paper. Those suffering from mental illnesses are affected every day and have trouble completing normal activities that a healthy person would be able to accomplish. During the 1800s, people who were deemed mentally ill and insane would be sent to mental hospitals and asylums, where the patients were horribly mistreated and forgotten by their loved ones. Dorothea Dix would later witness the mistreatment and abuse of the mentally ill prisoners. This is a story of how she created a conflict over their treatment, later compromising by creating reforms that forever affected the lives of those suffering with mental illnesses.
On April 4th, 1802, Dorothea Dix was born in Hampton, Maine to Joseph Dix and Mary Bigelow. It is believed her father may have suffered from poor mental health, which began her passion towards helping the insane and mentally ill. Around the age of 14, Dorothea Dix started teaching at Sunday schools, which became her job for quite a while. Dix was forced to give up her job as a teacher due to poor mental state. Although Dorothea Dix was passionate about teaching, she knew she had to focus on her health. Later in 1830, Dorothea Dix was given the opportunity by Dr. Channing to accompany him to his household in the tropical island known as St. Croix. They set sail on November 20th, 1830. After reaching the island, Dorothea Dix witnessed African Americans being forced to work as slaves on plantations. Dorothea Dix later wrote in a letter home, "Your view of slavery corresponds with my own. These beings, I repeat, cannot be Christian. They cannot act as moral beings. They cannot live as souls destined to immortality." Dorothea Dix is obviously opposed to slavery, as she refers to these slave owners as being immoral, and appalled that the slave masters should commit such sins and call themselves Christians.
Witnessing slavery for the first time affected Dorothea Dix by gradually developing her mindset that everybody is equal, therefore should be treated equally. This event pushed her to fight for those who could not fight for themselves. Years later, the Minneapolis Journal posted an article explaining the beginning of Dorothea Dix's fight against inequality and documented her accomplishments. This article began by describing a Sunday afternoon where Dorothea Dix was standing outside of a local church when, quote, she overheard two gentlemen speaking in such terms of indignation and horror of the treatment to which the prisoners and lunatics in the East Cambridge Mass Jail were subjected to. She was forthwith determined to go there and look into the matter herself. End quote.
This is a turning point in Dorothea Dix's life, because the Massachusetts State Jail was the first place where she witnessed what the mentally ill people had to suffer through. After visiting the Massachusetts State Jail
and witnessing the mistreatment of prisoners with mental illnesses, Dorothea Dix presented her findings in a memoir to the state legislature, declaring that, quote, the state of insane persons confined in this Commonwealth, in cages, closets, cellars, stalls, pens, chained naked, beaten with rods, and lashed into obedience. Dorothea Dix believed that these conditions were inhumane, that no human should ever go through such torture, especially those with mental illnesses. Later in her speech, Dorothea Dix explained the conditions were, as painful and shocking as details often are, that from them you can feel more deeply the imperative obligation which lies into you to prevent the possibility of repetition and continuance of such outrages upon humanity.
Dorothea Dix is explaining the terrible mistreatment of mentally ill in detail, which helps the audience visualize such unjust conditions. She is using a tactic in her speech to invoke an emotional response and induce horror in the readers by explaining how dreadful and horrendous living conditions actually are, motivating the audience to take a stand and put an end to their suffering.
After receiving a positive response from legislators, Dorothea Dix became more compelled to influence the treatment of the mentally ill. In 1848, Dorothea Dix asked for a land grant of 12 million acres, which is nearly 3 times the size of Massachusetts. If the bill was passed, Dorothea Dix would use the land to build hospitals, which would benefit the mentally ill. After working for 4 years on the bill, it finally passed through the Senate House, but was unfortunately vetoed by President Pierce. This was a huge blow to Dorothea Dix's efforts. Devastated and defeated, Dorothea Dix dropped her sacred work and eventually went abroad, visiting mental hospitals on the European continent. Even though she didn't get the grant of 12 million acres, Dix didn't give up her dreams entirely, and was still determined to help those who are less fortunate. This shows that Dorothea Dix compromised by continuing her work, even though she did not receive everything she wanted. Still ambitious, Dix continued to visit hospitals and asylums across the country. She documented poor conditions, fought for human rights, and still managed to fund several hospitals in Rhode Island, New York, New Jersey, Pennsylvania, Indiana, Illinois, Kentucky, Tennessee, Missouri, Maryland, Louisiana, Alabama, South Carolina, and North Carolina.
Later in 1848, Dorothea Dix presented a memoir to the North Carolina General Assembly, explaining her ideal conditions for mental hospitals. For instance, Dorothea Dix states that when working with mentally ill patients, the most exact observance of the truth shall be preserved in all intercourse with the insane. And the patients are sensitive to truthfulness and fidelity in others. Once deceived by a nurse or attendant, they never a second time bestow their confidence upon the same. same individual. Dorothea Dix is conveying that mentally ill patients respond well to being given the truth. and if possible, nurses and doctors should treat their patients with care and avoid deceiving them. Just like any sane person, the mentally ill respond poorly to being lied to. Later in her memoir, Dorothea Dix quotes Dr. Gray by saying that it is an error to suppose that the sane can labor as productively and as informally as the sane man. The manner in which labor exerts a beneficial influence upon the insane mind differs no doubt.
This means that mentally ill patients should not be expected to perform labor to the same extent as a sane man would. Although performing specific types of labor can improve the mental state of such patients, Dorothea Dix also goes on to say that a, quote, patient insane for more than a ton, 6 years, and beyond hope of recovery, considered dangerous to the public safety, yet finds constant and profitable employment upon the farm, an industrious individual, cheerful, happy, and useful. His labor more than pays all his expenses and supplies him with sufficient indulgences. This shows that even the most insane patients can still make a living and take care of themselves, instead of staying in a mental institution for the rest of their life. In conclusion, Dorothea Dix explains how the sane and insane are similar in some ways, although the mentally insane need to be treated with more care and respond better to different tactics, and if their mental health does not improve, the patients can still make a living on a farm.
Dorothea Dix succeeded in affecting the future mental health by improving the horrendous conditions of mental hospitals. Unfortunately, problems surrounding mental health still exist today, from the way that mentally ill people are treated to the way their conditions are perceived by the public. Without proper policies or support, many families struggle to maintain afflicted woes, and many mentally ill people do not receive the care that they need. Countless people suffering from mental illnesses are wrongfully put in jail where they do not belong. These harmful environments often make their already bad conditions worse, damaging their mental health. Some mentally ill people are put into solitary confinement for crimes they did not commit, but only because of their mental state. Solitary confinement is one of the worst things that can be done to mentally ill people.
For those who are already ill, it is a quick route to deep and lasting psychosis, a severe mental disorder in which thought and emotions are so impaired that contact is lost with external reality. Solitary confinement often leads to suicide, and in jails and prisons, if any of the prisoners are caught trying to commit suicide, or it is found that they try to commit suicide, they get beaten or worse. Also, placing mentally ill people inside of prisons can be dangerous for surrounding citizens. For example, quote, mostly mass shootings perpetrated by people suspected of being in psychotic states, end quote. An excerpt from No One Cares About Crazy People by Ron Powers shows that if some mentally insane people were not guarded very well or kept safe, they were able to escape and cause pandemonium. In conclusion, treatment of the insane has not changed as much as we would like it to have changed.
At the age of 59, Dorothea Dix volunteered as a nurse in the Civil War and formed an Army Nursing Corporation as the superintendent nurse. Never missing a single day of work, Dorothea Dix encouraged over 3,000 women to volunteer in the Army. Meanwhile, she established hospitals, inspected hospitals, and raised money for medical supplies. After the war, Dorothea Dix began her job again, although in 1881 she became mentally ill. She retired to her private apartment, set aside for her at the New Jersey State Hospital, which was one of the first hospitals which she had founded. Dorothea Dix continued to write letters from her bed to support her crusade for the mentally ill.
After 85 years, Dorothea Dix passed away on July 18, 1887 in New Jersey, where she was found inside a hospital that had been founded in her honor. Dix was buried in the Mount Auburn Cemetery in Cambridge, Massachusetts, which was nearby the East Cambridge Jail, the first place where she witnessed the abuse of the mentally insane. Her death was a tragic event which caused sorrow to many people, especially the ones she had helped. This graph shows how Dorothea Dix impacted the future of the mentally ill later on. Mental hospitals were able to find new treatments for the mentally ill and were able to reduce the number of people that suffered from such illnesses.
This timeline shows all the important dates in Dorothea Dix's life from when she was born in 1802 to when she died in 1887. Throughout the timeline that is her life, Dorothea Dix became a teacher, witnessed the abuse of mentally ill prisoners, wrote letters and contacted state legislators, passed reforms, volunteered as a nurse, and founded hospitals, and left a lasting effect on mental health. Ultimately, when Dorothea Dix first witnessed the horrendous conditions inside of mental health hospitals and asylums, she was determined to take a stand and improve the unjust treatment. By stirring a conflict and taking compromises, Dorothea Dix affected the treatment of mentally ill patients today and changed how we view those with mental illnesses. Although mental health care is improved by the 1800s, many mentally ill people do not receive the proper care that they need today and are left unable to care for themselves. It is not that we have forgotten or not learned about mental illnesses. It is that we don't have a way to reach everybody, rich and poor, with the care that we know how to give. If we, as a society, don't do something to change, many mentally ill people will be left unable to maintain jobs and receive the care that they need to improve.